and I will just to join as they come in. So good evening, everyone. Thank you so much for being here. My name is Alex Early, and I'm a pre-health advisor in the pre-professional office here at JHU. I'm super excited to welcome you to today's panel featuring some of your fellow Blue Jays, some outstanding students who have recently been accepted into medical school. And this is an awesome opportunity to kind of see firsthand and hear firsthand what their journey to medical school was really like, including their coursework and kind of MCAT prep to their acceptances. And so our panelists have successfully navigated a difficult road, and they're here to share kind of what worked for them and any challenges that they've faced. And so we will start with a few questions for our panelists from myself, and then we'll open the floor to students to ask questions. And so please don't be shy, students and alum. Make sure that you have some really good questions. Feel free to take notes and yeah, feel empowered by what you hear today. And so I'm going to start off now with some introductions. Feel free to start us off, Zeta.
Hi, I'm Zaida. I graduated in 2023 with a neuroscience major, and then I took 2 gap years, and then I'm finally going to med school in the fall, which is great. And I'm happy to answer any and all questions you guys have. I guess I could popcorn it, I guess, to Vaughn.
Hey everyone, my name is Vaughn. I graduated in December 2023, so technically class of 2024. So I took a gap and a half, but my major was molecular and cellular biology. And yeah, I'll also be going to med school this summer. I'll popcorn to Ashley.
Hi, I'm Ashley. Much like Vaughn, I graduated in December of 23, so took a year and a half gap, majored in molecular and cellular biology, as well as history of science, medicine, and technology. And I'll popcorn to Toby.
Hi, everyone. Thank you guys for being here. My name is Toby, and I also graduated in 2023, and I majored in neuroscience, and I am on my second gap year now.
Awesome. Thank you so much for introducing yourselves. And I'm going to jump right into the questions. And so my first question for you all, and I can repeat myself because it is a lengthier one, but what resources, so including books, any courses, study tools, or extracurriculars, did you find most helpful during your pre-med journey, especially when preparing for the MCAT and for applications? And whoever would like to kind of start, feel free to unmute yourself.
I can start if no one else wanted to start. So I think one of the most useful material for me to study for the MCAT are the free resources available online. I took a lot of practice tests on UWorld. I think it's an amazing site. And then there's another website called Jack Weston, and that includes a lot of material, like kind of like free courses, chapters to kind of like help you explain some concepts. I think it's very helpful for me. In terms of the books, I bought the Princeton Review. Like a lot of people have been saying that like the Kaplan book is also amazing, so I would definitely recommend one or two. And then for application, I think SDN is definitely. I know a lot of people have been saying SDN can be like toxic, but I do find their information about the secondary question pretty useful. And I know that like there has been a website called admit.org that has been developed recently, and they have a very extensive database in terms of the secondary questions, like the statistics of the school. So I found those very insightful.
Yeah, I would absolutely say like all of the same things that Toby did. I personally used the Kaplan books and I found them really helpful. The one other thing is Anki. So I used the like Miles Down Anki deck, and that covered literally everything. As well as some extra stuff that the Kaplan like psych soc books didn't, that did come in handy. But that's yeah, that, and then there's also the like the AAMC's own like question bank and flashcards and things like that. I used that a little bit. Probably should have used it a little more. So highly recommend starting with some of those.
I also used Kaplan, UWorld, and Anki. So I actually wound up taking the MCAT 2 times. And so the first time I went through it with mostly Kaplan, and kind of did a lot of the questions through there. But then the second time I decided to change things up, try something new. And I felt like Anki helped out a lot because it was, a lot of repetition of the materials. So that way you're kind of constantly seeing it day by day. It's also something you can do like a quick 30 minutes in the morning if you're busy during the day. So I'd highly recommend that. Um, and otherwise, I'd also say, like, in terms of resources, reach out to friends, anyone who's gone through this before. That's a huge resource as well. I think they could provide a lot of insight because everybody does it a little bit different.
Yeah, I mean, I would echo everything. Personally use Kaplan, um, but I really liked Anki as well. UWorld, double AMC. One thing that I recommend with the double AMC like question bank, and they have some exams as well, is like save those until like right before your not right before your MCAT, but closer to your MCAT. So it's like start with Kaplan, other things, and then move more towards double AMC because obviously they're the ones who will write the exam and do that more. So that was like one thing that I felt was really useful for studying for the MCAT. And then in terms of just like overall application, I think like building your timeline kind of early and knowing exactly like when secondaries are going to happen and when you should start preparing and when you're going to take your MCAT and just knowing kind of the big timeline, is it's good to be able to reference and know like where you're at in that space, especially if you plan on applying. When you start that like, oh, I'm going to apply in a year because it is a long year cycle. So like knowing the timeline is super helpful.
Awesome. Thank you so much for answering that question. And we're going to now move on to how did you utilize the pre-professional office at JHU, and what specific services or guidance did you find the most helpful?
I guess I could start kind of like what I was mentioning before, is like knowing the timeline. So pre-professional, I think, is very great at reminding you, like, hey, this is coming up. Like, this is when you need to start these. Like, take those dates seriously, and like really consider them because they're super helpful and they make it like less chaotic, because everything does start to come up really fast in terms of when things are due, especially like when things are due to Hopkins to get your committee letter versus when things you're gonna have to like do for the primary application, and then also in like secondary timing. So one thing is just like taking those timeline diagrams, like those are super useful. But I think for pre-professional advising, I also took in like the workshops of writing your personal statement, as well as I think it was secondary time. They would offer things of like how to know how to start crafting those or drafting them before you even got secondaries sent to you, so it can kind of just get you in that mindset so you're ready to write them when it's time. And those are some of the things that I particularly use. Oh, I do want to mention if you kind of know going in or you're about to apply, like checking in with them. They're very good at telling you, like, yep, you're on track, or no, maybe do this. So using that, like one meeting you get, or at least one meeting every couple of months or so, if you're a little bit further away from applying, just to like verify, like, am I doing the right things? Am I on the right track for when you want to apply, or is maybe a gap year what I need to do? Just using them as kind of a check-in point is really useful.
Oh,
Go
go
ahead,
ahead.
Ashley.
Okay. I would say in a similar vein, I like just even from like sophomore year on, I was kind of like making sure that I set a meeting at least once a semester to just be like, here are the new things I'm doing. Here are the things that, I have been continuing to do, like so on and so forth, just to kind of have like a little bit of peace of mind that like I'm not veering off like track immensely. But then much closer to like when I was actually starting to like put everything into AMCAS, like when it opened, there were definitely a lot of moments where I was just like, oh my gosh, there's like this tiny little detail that I have no idea what this means or how I should put this in. And those were the times when I was like, I really need help like figuring this thing out. And the pre-prof office was like very helpful to just be like, okay, like it's okay. It's just a little detail and it'll be fine. So like as much as they are very helpful for like the big things, also very helpful for just like minutia where you're like, I've never done this before and I need help from somebody who has seen it many times. Um, Also, I would definitely recommend like having your personal statement reviewed, like doing the mock interview, all of those things, like any of the optional things that are available, take advantage of them. Like as far as I know, they're all free and available to anybody who wants them. So like you can only do yourself a service by using them. Like it's not ever going to hurt you. So you might as well.
Yeah, I will second both Zeta and Ashley said earlier. I think the workshops for writing personal statements so great. I personally took a course with Suri during intercession for writing personal statement. I know like she also covered a lot of the same materials during the workshops, and I think it really helps me connect the dots. I know like, a lot of us exceptional students have their narrative ready to figure out before they come into college. For me, I'm kind of like just doing a lot of things. I'm not really sure what my narrative really is, but like taking that class, going to workshop with Suri really helped me connect those dots and kind of formulate this like unique personal statement for myself. I think that's very cool that the pre-professional office offers. Another things that I utilize is the mock interview. I was paired with an alumni, and the mock, like the multiple mini interview mock, is also very helpful because like a lot of us doesn't really have that experience. It's our first time being exposed to that. So I think have a lot of practice and kind of get used to or familiarize with yourself with the format is pretty important. So I would definitely recommend those resources to you guys as well.
Yeah, I think I did a little bit of kind of what everyone else was mentioning. I even took the intercession course also, which I felt was really great. So if you're kind of not applying necessarily this year, like if you have more time, I would definitely recommend that because that was really helpful. I guess I'll say like I felt like drop-in hours were really helpful too. Because that was something that was always available. It wasn't like you had to plan a month or a few weeks out ahead. You could just kind of pop by, especially if you have any like quick questions. That really like provided a lot of ease of mind. Because there are going to be some times where like it feels a little stressful or we're all going through this for the first time. So just being able to ask those questions or kind of bounce an idea off of someone can really help.
Awesome. Thanks so much for sharing. And again, we are definitely here to help all of you navigate this journey. And please feel free to email us at preprofessional at jh.edu. If you ever have any questions on our programming, make sure that you check your email. We email every week about our programs, and we have a newsletter that goes out as well. And so, yes, we are very safe. We do provide a lot of feedback, especially around this time of year with personal statements and all of that jazz. And so my next question is, what are some tips you would give when it comes to creating a target school list? And what resources did you use that helped you understand what schools were a good fit for you?
I can start. So I think the resource that I used for the most part in creating my list was MSAR. And that was more so to obviously see like, medians for MCAT and GPA and like not just median, but I would say especially like their 25th percentile. Um, just because anything below that, it's like you can apply, but like who knows what's gonna happen. I mean, you never know, but still, at least you'd like to give yourself a little bit better of a chance. Um, but well, I guess as a side note, I would say you can also filter with like accepted versus matriculated and all of that and in-state, out-of-state. So that was definitely helpful, especially to see like I know a lot of people look at out-of-state schools, but then don't quite realize that like they take 5 people from out of state or something. And so it's kind of like hedging your bets. Um, but like Toby was saying, I didn't realize this was a thing when I was making my list, but admit.org is like amazing. I definitely used it a lot, like going through the process afterwards to just kind of see like, how things were going. But if I had known about it at the beginning, I definitely would have used that because you can see people's profiles of like what their stats are, like MCAT, GPA. There's an admit score on there, so you can kind of like for yourself, you can get a sense of like where you land because it takes into account a lot of different things, not just your stats. And I found that it was pretty accurate at telling you what your like target reach and like safe, if you can call them that, schools are. So I would definitely recommend at least just cursorily checking it out, even if you don't put like all of it, your effort into it.
I guess I can also speak a little bit about that. For me, I think choosing a school is definitely one of the most challenging and also um, like after going through this process, the most important aspect of, how a medical school also chooses you is like to figure out the match. Like for me, I always want to do something around with medical technology. I'm like big on AI, so I'm really looking for a school that not only emphasis on the traditional medical education, but also on integrating AI and technology into, promoting the welfare of the wellness of our patients. So I was looking at school that does offer that option, and I'm also considering doing dual degree. So I did look at schools that offers dual degree programs on their website. And a lot of students, including myself, like I find that a lot of schools actually share a very similar curriculum. Like you really can't really kind of like tease out the difference. Like they're all like accelerated pre-clerkship, like regular clerkship rotation, and have like fourth year as kind of like your elective year. But I do think that the school are looking for how is there like a match with their school mission? And the mission really comes down to the patient population that they serve. So what kind of patient do you really want to serve in that city? Like for example, in Chicago, like especially University of Chicago, they're really looking for students who are able to work with underserved populations. So like when you're like thinking about what you want to do in medical school, you really want to make sure that this is the population that you want to serve and work with in the future. Um, and that kind of like helped me narrow down the schools that I would like to go to.
I wanting to echo off of that, like location, if location's a big thing for you, knowing where you're from, like I like exactly what Ashley said, know what the out of state numbers are. If you're applying to schools out of state, be realistic about that because some schools really do care and some schools are very limiting in terms of how many they admit out of state. Some schools don't. Some schools even for their secondaries, they ask like why location? So they're like, what ties do you have to that location? What ties do you have to that state? And so thinking about that in terms of like if you're choosing these specific schools, they may want you to have that kind of location connection to them. So thinking about that, there's also in terms of curriculum, they're all very similar, just like Toby said. But I think if you, for example, I have a heavy research background, I knew that I can like kind of sell myself to a school that way. And so like looking for schools that care about research, maybe they have additional research years or it's part of their required curriculum to have a scholarly project or things like that. You can kind of, if that's something that you want to do, or if that's something that you know you're going to need for applying to a residency that you think you want to go into, like looking into that consideration is like not every school they have, of course, the time you're going to get you're going to have your pre-clerkship, you're going to have your clerkship years, you're going to get a great med school education anywhere. But whether you have the time to do the things that you want to do, like a research project, clinical research takes time, right? Or whether a curriculum builds in the times to do those extracurriculars. So I know some schools that care about social policy, they have built in like distinction tracks that allow students to explore that field. And so if that's something that you're interested in, that's where you can maybe see variation in terms of curriculum and education that they provide. So like the standard curriculum will be the same, but like the opportunities they offer, like the dual degree could vary. So that I felt like was kind of useful and that unfortunately I feel like sometimes requires some digging at each school's independent website to just kind of know. I Preprov has their on the YouTube website, you can see the like recorded visit schools. So those sometimes help if you can just like briefly speed through the recording to see if they offer any distinction tracks or things like that in terms of dual degree that I think is useful for like crafting your school list. But I definitely think like keep an open mind. Like, of course, you're going to apply to as many schools as you feel comfortable with. Every school costs money to apply to, especially when it comes to secondary. So you don't want to apply to every place but like think reasonably in terms of you want to be able to just apply to med school once. So like be kind of not broad, but open to schools that maybe you would be happy to go to, but aren't your top choice because you never really know. And unfortunately, with med school, it's kind of like you never really know what's going to happen. So you have your dream schools that maybe they let you in because you're an amazing student, like all of us are. But then you have your other schools that you feel like I would be happy to go there, but I feel more not safe but comfortable knowing that I think I could sell myself to them if that makes sense. I think those are the things that I thought about when crafting my list.
Yeah, I think we hit like pretty much most of the points, if not all of them. Some other things that I would add in maybe are like considerations, seeing yourself as a student there. So maybe stuff like pass fail curriculum, what type of grading is going on, other things that they might incorporate into the curriculum. So some schools are more like service oriented, others might be more research oriented. Um, so looking in, kind of digging through the websites, trying to figure out that side of things. Um, yeah, I think we we kind of got through everything there. But yeah, it's more than just the numbers on the MSAR. I mean, that definitely like kind of tells you maybe what sort of ballpark range you might be shooting for and how you kind of align with the school and what type of student they might be looking for. But there's other things too that can make you stand out and like really align with, who they're hoping to bring in with their next class.
I would also say two other things. One, I personally didn't apply to any schools that needed Casper or Preview. That was just my choice. I was like, I don't want to take more things and have to go through more hassle, and who knows how that's going to be scored. So I didn't apply to any schools that needed them, or I mean, a couple of them like said you could take it or they used it for like research purposes, but I didn't apply to any that required them. Which like I still had a pretty hefty list. And the other thing I would say that kind of goes off of what Zaida was saying is it's not just the money for the secondaries, but also like what questions they're asking. What I ended up doing after I'd figured out my list a bit more was looking through all of the questions that those schools ask and kind of categorizing them and seeing like how many of these overlap, how many of them are kind of completely different that I'm going to have to craft something new for. Because while you're not, going to be copying and pasting into all of them, you still do have the same foundation for like those types of questions that are just like, oh, tell us about yourself or whatever. And so if there are a bunch of them that are just like completely random questions, that's just going to be a lot more work. And so if you're really dead set on that school, great. But if you're not, perhaps you don't need to do all of that work. So that's just another consideration.
I guess also one other thing which I forgot to mention or is also finances. There's a lot of schools nowadays also that offer like either reduced tuition or completely covered tuition. And that's something huge to be able to walk out of medical school without any debt. So that's something else to consider, maybe looking into like the cost of attendance or what opportunities are available. Do they consider merit versus just need-based financial aid also? So some other things to think about and look into.
Yeah, and I just want to add on what Zeta and Vaughn said before. I think I completely agree. Like I think stats, especially the mean, I don't know if they're doing median or mean on their page, but like it's just like one number, right? Like if your like stat is not like, exactly that number or above, like don't feel discouraged to apply. Like there are a lot of people in that like 75 percentile, like 25 to 75 percentile range. So like I think you should definitely apply if you think the school is right for you. And then another thing I would say like from my very biased experience, because I'm really looking for schools that foster this kind of like interdisciplinary study. Although like most schools curriculum are very similar these days, I do find several schools curriculum being pretty unique in its own way. On top of my head, I always say that I know UPenn has a very cool interdisciplinary called One University principle where they encourage people to like go collaborate with other disciplines. I know that Hopkins had the Gene to Society curriculum where it allows you to do a lot of like social like medicine stuff and like policy. I know Stanford does a lot of they have their scholarly concentration where you're able to like take courses in other like discipline. Like if you're interested in engineering, you can take, courses with their CS department, those kind of stuff. And then I know also Harvard, MIT has a pretty basic science and engineering focused curriculum. Like you are required to take those courses in addition to your clerkships. So I think these are like kind of like unique curriculum. That's kind of like what I'm looking for when I'm choosing a school. But if that's not something you're looking for, please disregard what I said.
Thank you all so much for all of your insight. That was really, really helpful. And again, make sure that you are all doing the homework as you're creating your school list. Make sure you're digging, make sure you're going to info sessions. If you're able to tour the school, also utilizing our YouTube page that's in the chat, really helpful to see some of the previously recorded sessions with other schools. And so I'm going to ask one more question, and then we're going to start to kind of switch it over to letting the participants ask some questions. So my last question for you for now is, can you walk us through how you chose your extracurricular activities, including clinical experience, research, and volunteering? And also, what did you prioritize and why?
I guess I don't mind starting. So while he's there, I want to say I didn't. So I knew going into my undergrad freshman year that I wanted to apply to med school. That may not be the case for everyone, but I did know. So I kind of knew that I was going to have to build this resume. And I wanted, of course, like everyone else, probably wanted to go straight through. I didn't intend to take a gap year. That wasn't part of the plan. But I think when choosing my extracurricular activities, I kind of chose things that I felt like I could kill two birds with one stone, but also things that I liked doing. So I knew that I wanted to get involved in research because I felt like having a research background was something that I really wanted to have. I really felt like I would enjoy it and I wanted to explore it. I'm going to be honest with you. I also thought I would do MD PhD, partially because it was fully funded at the time. So I was like, maybe that's something that I wanted to do. So I felt like, okay, I should get in research early. So I basically, honestly, how I found my lab was based off the like Hopkins emails that they send every time. I think it was like a today's announcement or something. So they could be anywhere. Hopkins is constantly throwing a ton of opportunities. And so those random emails that you're getting every single day, like look at them just briefly because you never know that could be the opportunity that's for you. And honestly, that's where I found my first lab, and that is the lab that I've stayed in and got to do my gap years in. And so like I love that lab and they're my family and I'm so excited that I'm like grateful that I found them. And it was of course that random email. So the opportunities are out there for you to find. So when choosing that, is kind of purely of interest. I will talk specifically about research. It doesn't, don't worry too much about the method unless you know exactly what you want to do in terms of research method. Think big question. There's likely things that you're just curious about. So see if you can find a lab that cares about answering that same big question. And then it's kind of fun to figure out, okay, what specific methods do they use to answer that method? And that's just a learning process. In terms of other extracurricular activities, I also, for me, I knew that I wanted to build relationships with professors. And one way to do that, I really like to teach. So I was like, okay, I'm going to pick courses that I want to TA for possibly. So that was one thing that I did. And then I also did like study consulting, um, which was great because it was paid, and like tutoring for volunteer work as well. So I kind of, with all of my opportunities, I wanted to make sure that I was doing something that I liked, but maybe it gave me some extra spending money, but it also would hit something, of course, that's beneficial for med school, like volunteering or learning to teach or things like that. In terms of clinical experience, again, I want to say for me, and I think all of us, COVID happened our freshman year around that time. So you kind of had to shift. So I think the goal at that time was to just show that you're putting an effort to find clinical experience and to understand the clinical environment. And I think that's still the same now. As you want to, with any clinical experience, of course, you're not a trained medical assistant. Maybe you don't have the certification. Maybe you're not an EMT. So you're not going to be able to like treat patients. Like that's not what I think the clinical volunteering or clinical experiences med schools are looking for. I think they're looking for you to genuinely show that, look, I've spent time in hospital settings. I've spent time in clinic. I know what it's like to be around people who are in very, very unfortunate times in their life. And I know that I want to be there to help them in that case. And so you can volunteer at the hospital, you can volunteer at like hospice centers, like anywhere that you kind of want to be around patient populations and people who are in vulnerable states, I think are huge. If you do clinical research, that's kind of two birds, one stone, right? You're in a clinical setting, but you also are doing research. And so I will be honest, I think my clinical experience background on my application wasn't as strong as I wanted it to be, but I think I was very good at, I knew that they wanted to just know, I know what it's like to be around people who are in these vulnerable states. I know what the medical field means. And so that's kind of the most important thing. But I want to say when choosing it, so again, like main thing, make sure it's things you're interested in because you want to show long-term dedication and commitment. So things that you're willing to stay in for a long period of time. And then also just like if you can check multiple boxes, not that we want to check boxes, but if you can do things that are beneficial to you in multiple ways, that's more ideal when you have to like choose between different opportunities. I think that's a way you can decide.
Thanks for that. And does anyone else kind of want to add on to what Zeta mentioned?
Yeah, for sure. I really like what Zeta said about like choosing something that you're very passionate about. I think that's kind of like how I choose or prioritize my extracurricular experiences. I just know that like I have interest in computer science as well as medicine. So I joined a lab that's like big on, creating digital twins. And I think having great mentors is so important. So like when you're choosing a lab where you're choosing like your gap year job, always trying to find someone who is not only great at what they're doing, but also available. I think accessibility is one of the, like, I think the biggest factor I would say in choosing mentor. Um, and I happen to have great mentors throughout my like journey. So I think it really helped me grow a lot as a person. And for clinical experiences, I like I immigrated with my mom when I was 14 in Baltimore, so I always wanted to do something with the population in Baltimore. So I got trained as EMT and I worked for Baltimore Fire. I think it's a very cool experience. I definitely think that having a hands-on experience as an EMT really helped shape me who I am, especially in Baltimore City. There's a lot of health issues, a lot of violence, a lot of crisis going on. So to see how social determinants of health really interplays with a lot of social factors helped me realize who I want to be as a doctor in the future. And I also worked as a scribe at the Cleveland Clinic, and that opportunity actually came from the pre-health newsletter. So I definitely recommend checking it like quite frequently, as Zeta was mentioning. And in terms of volunteering, I kind of just did one volunteering I've been doing since high school in Mercy Medical Center. And I found it very enjoyable. And just overall, I think like, there are definitely a lot of things that we have to do as pre-med, but definitely prioritize things that you really enjoy doing. I think by kind of prioritizing your passion, like you're able to make your activity more in depth and also more sustainable because you feel like you like doing it, right? So you keep doing it. So that will be my advice on choosing my experiences.
Uh, so I guess I'm on the same wavelength as Toby because so I've been an EMT for the past 2 years and also been working as a medical scribe. Uh, as far as like clinical experiences, I also volunteered at a couple hospitals, one kind of locally, like a smaller hospital, Princeton Medical Center, and also at Hopkins Hospital in the emergency department. So I think definitely those clinical experiences are a huge positive. And especially being able to talk about like different patient settings, different specialties, inpatient, outpatient, and also understanding like how everybody works as a team. So not just, doctors, but also nurses, PAs, techs, the entire team that it takes to take care of a single patient and everyone involved. So to be able to talk about that, I think is really huge. And it just kind of shows that you already kind of know a little bit about what you're going into. Um, but otherwise, yeah, definitely find things that you're passionate about, that you find interesting or fun. It makes time fly that way too. So like for EMTing, I volunteer with like a local squad, and I take my pager and radio home every day. So pretty much anytime there's like a backup call, like I can jump on and go help somebody and potentially one of the worst moments of their life. So you can definitely make an impact. And I think just as you're approaching the application and going through your extracurriculars and your experiences, I would definitely recommend like taking some time to maybe take a step back and reflect on, what your position is, some of the things that you've learned in your time there, any like big experiences or insightful moments that you've had over the years. Like that's definitely going to be really helpful, not only for like interviews down the line, but also to really put yourself out there in the primary application too, because at the end of the day, when you're applying to these schools, sending primaries and secondaries, that's kind of all they get to know about you. So the more that you can highlight and really show how much you've done and all the incredible things that you've done across, your 4 years or however long it's been, you just want to showcase what you're bringing to the table. So, yeah.
Yeah, I don't have much more to add. I would just say, prioritize the culture of the like organizations or labs or anything that you're joining. Um, yes, it's important to enjoy what you're doing. Sometimes it may be a little bit tougher. Like you'll go in and be like, okay, I don't really know what I'm doing. Like I don't know everything that's going on. If it's like really bad, obviously don't stick with it. But, there's a lot to be said about kind of like pushing through a little bit of discomfort and like learning something new. That's also something that can be talked about on your application. Like nobody expects that you just go in knowing everything. Um, but I would also just say, like anecdotally, I ended up only having non-clinical volunteering and then I had clinical work, and like that's perfectly fine. For example, I was an APO like all 4 years, and that gave me a lot of really great volunteering experiences. So again, it's kind of just like however it works out for you. Um, but I did do the clinical research combo. So I only did volunteer research in my undergrad. And then once I graduated, I was still doing research, but also doing clinical work. And so that was a really nice segue that I didn't have to go searching for. And it was like a letter from somebody who had known me for a long time. Um, I would also, last thing, just say like if you are applying soon, it's still perfectly fine to start like a new volunteering something or the other. Um, you can't necessarily put like stuff that you're going to start in the future on the application, but if you're starting it now, like right before it starts, and then you can say like, oh, I'm anticipating doing this many hours, like that's great. Obviously, you'd like to have some volunteering hours before you apply, but it's certainly perfectly fine to say, I'm starting this new thing now that I have more time. And, I think that's actually really great that you're like not just continuing to do all of the same things that were done during undergrad. Like that's definitely something that I actively fought against when I was like graduating, since I've been in Baltimore for so long and I stayed for my gap year and a half, that I wanted to have a little bit of change, something new that I could talk about that would kind of like spark something in me when I was writing my application.
Awesome, thanks. And again, it sounds like it's on everyone to kind of do some homework and see, what are you passionate about and how can you kind of turn that into a clinical or non-clinical experience. Our office also has a clinical guide. And so whenever you meet with a pre-professional advisor, you can chat more about ways to gain these experiences. But now for the remainder of the 20 minutes, we're going to allow the participants to ask you all some questions. And so there was one question in the chat regarding gap year. And so if that participant would like to unmute themselves and start us off, and once that question's answered, feel free to unmute yourself. Be sure to be courteous to one another as you are unmuting yourself so you're not talking over one another. And also, please just be mindful, there are certain questions that our participants may not feel that they would like to answer, and that is totally okay. And so, yeah, go ahead and start us off if you are still here with the gap year opportunities question.
Hello, everybody. Thank you for being here. I really enjoyed listening to what you all had to say, and I'll get right to it. I was going to ask about, gap year opportunities. I know Ashley, you mentioned that, and I think Zeta also mentioned that too. But I was wondering if you could, explain more about why you chose the opportunities that you chose. And what was the reasoning behind that? Because I'm at a point where I also need to make a decision on some of those things. And I want to see if there's any opportunities that have like the highest yield that could like boost your application. For example, if you have an option between like staying another year as a volunteer researcher versus paid research, is that one better than the other? Especially if you've also already built like rapport with your current lab, is it better to like uproot all of that and start something totally new, or just keep doing the stuff you've been doing? And also maybe on as a follow-up question to the gap year is like, how did you add structure to your gap year? Because one thing that worries me right now is like not having structure and like letting things slip when you have to set your own deadlines and you have to base, there's no classes, there's no assignments, there's no deadlines in that sense. It's more just you being on top of things. I'm wondering how you dealt with that. Thank you.
Since I was just talking about it, I can start. So in terms of the big things, so like for research, I had a similar kind of deliberation. It was a little easier for me to decide to just stay in the same lab that I have been in since like my sophomore spring because I was transitioning into that new role of like a clinical research assistant where I was actually like testing patients and things like that. I'm in a like stroke and dementia lab. And so that was an added kind of like feature, if you want to call it that, to that experience. And I actually ended up splitting them on my application since it was quite different, like the research versus the clinical. I would say most people would go probably for the paid research just because like there are so many costs that are involved in like the application. And then once you're in med school, like pretty much everybody I've talked to is like, yeah, you don't work, like especially not in your first year. So if that's a consideration for you, certainly keep that in mind. Um, in terms of structure, I did, I think maybe a slightly unusual thing. Like I haven't met a lot of people who did this, but I didn't take on any full-time employment. I did like multiple part-time things. So I had like part-time as a research assistant, part-time as a medical assistant. I did a healthy amount of volunteering, both with like APO and also at another organization that I picked up just kind of towards the end of or after I graduated. And so all of those things in some ways actually helped with time management because I was like, okay, I want to put towards, this thing 10 hours a week. I want to put towards this thing 20 hours a week. And it's a lot easier to do that when you have multiple things that you're trying to do instead of just being like, oh, yes, I'm going to be working 40 hours a week. So that was kind of my thought process for all of that.
Yeah, and I guess I could follow up regarding the gap year. So I actually I was ready to apply. I like started my HPA and everything, and then I like decided not to. But in terms of gap year, it was, of course, get paid if you can. If it's like unless you're sticking with unless you're sticking with the lab because you really like the work, like if the research topic is super different, and so you're worried about like interest and passion, then of course, then I'd consider like, of course, don't do something just to get paid and hate the job. But definitely now that you're in a gap year, like you have to like exactly what the thing was said over chat. Like you have to feed yourself and thinking in terms of paying for medical school and paying to apply to medical school is expensive. So if you can get paid, can get paid. But you can talk to your PI or your people that you currently work with in the lab because that's what I did. So I was in my lab again since basically like freshman spring. And then I rolled over. To be honest, I did the combined BSMS program for the neuroscience department. So I did, but the only reason why I ended up doing that was because I talked with my PI about applying for a grant, a diversity NIH grant at the time. And so that funded 2 years of research, one for me to complete the master's because I had to be a grad student to get the grant. And so that's why I ended up doing that master's program. And then another for the additional year. And so you can maybe talk with your PI, especially if you've developed that relationship. You can talk to your faculty advisor, your mentor at the time, and likely they would want to pay you. Like they want to get something, they want you to benefit from it if they're like truly care about your interest. And so you can think about funding opportunities, ways to get you funded to maybe stay in that same lab if you still want to stay, or you can tell them like maybe they have. I mean, given the current state with funding and research, I'm not sure, but likely there may be some way that you can still get funded to do the research that you want to do, especially if that's something that you're interested in and you built that rapport. And either way, if you end up volunteering, I think it will reflect in your letter of rec, right? If you really built this mentor and you've built that relationship and you have these projects and you're growing your like leadership role in this lab, that's huge. And so kind of like Ashley was saying in terms of her position change, that's exactly what happened with me as well. As like once I did this master's, I had my own independent project now, right? I wasn't like just helping with another project that some postdoc had or grad student had. I now had my own independent work that I'm doing. And so if you can shake that and write about that in your application, I think that truly means something. And it shows that you can like develop and grow within a space, which I think is super helpful as well. In terms of like prioritizing timing and stuff, yeah, I work the 40-hour week. Of course, creating your own deadline, sometimes you kind of just have to do it. It is really hard, I would say. It's a transition, but I think you kind of figure it out. Of course, you talk with your mentor, you set your new deadlines. Now I have project deadlines. Now I have like my assignments aren't homework assignments. They're, oh, I need to write up this abstract for this submission or something like that. So they just shift. But yeah, it's kind of you could sort it out either way.
Yeah, I agree with both Ashley and Zeta. I think they already said so much great stuff already. One thing I would say, like just kind of like pertaining to the question that was asked in the chat, what opportunities give the highest yield, especially for MD PhD programs? I'm personally not an MD PhD student, but I know that a lot of students who are in the MD PhD track does the NIH fellowship after graduation, the post-bac fellowship. They either work in a basic or translational research lab, and that usually, depending on your mentor and the type of research you're doing, that will usually give you a lot of research productivity. And I think for MD, PhD students, your research productivity is being valued more so than your clinical experience. Not saying that you shouldn't do any clinical experience, but I think you definitely should focus a lot on your research as well. And in terms of just like gap years in general, when I was deciding what to do for my first gap year, I was looking at back at my kind of like overall readiness. I feel like, I did a lot of research. I feel like my clinical exposure is kind of like my weaker part. So that's when I decided to do a scribe for my first gap year. I think like a lot of times when people think about medical scribing, they think it's more as a passive kind of like clinical experiences. But I would say that I learned the most from medical scribe more so than other activities I had. The reason being that you're like maybe also because I'm working with one like physician throughout the year. So I was really able to learn a lot of terminologies, how he's able to kind of like arrive to a conclusion or diagnosis. His logics and those kind of stuff is really important for me. And he also is a teacher, so we'll have a lot of medical student coming in shadowing with him. So I feel like I'm learning alongside with them and trying to become more kind of like versed or familiar myself with kind of like the clinical workflow. And at the same time, I'm also doing part-time research. And I think as a pre-med, I'm pretty distant to the idea of networking. I was not used to doing networking whatsoever, but I feel like it's a very undervalued skills. I was just like on LinkedIn and I was messaging people like in Cleveland Clinic. I was like, hey, like, do you want to like go over my application? Like you used to work for the school I really want to get into. So I was just cold emailing those people, and actually some of them responded to me. And one of them, after talking with me, was like, hey, like you did a lot of very similar work as me, like in your undergraduate time, like why don't you just work in my lab? So that's how I was able to get my gap year job. So I think obviously like search for jobs systematically, but at the same time also like you can try to co-message people. I think like networking is a way to get jobs as well. And then for my second gap year, it's kind of my passion of like, kind of have culture exchange, kind of like bring medical technology to our global community. And that's why I decided to do a scholarship and kind of like, work on my research project abroad. If you had the bandwidth of, trying to apply for those like scholarships or like, awards to do research abroad, or in a different country, like I think it's also a very good way to spend your gap year and kind of like boost your research productivity. I hope that answered your question.
I guess one other thing also, and it's going to sound a little bit cliche, but if you do wind up taking a gap year, I know as a student, you feel like things are very scheduled and, day by day, there always needs to be something to do. But maybe also try to find like a new hobby or something fun to do on the side. It could be gardening, or I picked up like pickleball and now rock climbing. So there's all sorts of like new things that you might want to try out, and it's a perfect time to do so because you're not, in classes 24/7. So
Yeah, that's a really great point, Vaughn. Hobbies are just as important as the other experiences that we've kind of talked about earlier. And so we have time for probably two more questions. And so feel free to unmute yourself if you are a participant who has a question for our panel. Any questions? And if not, I can definitely ask one more to the panel myself. So I'll allow maybe a couple more seconds if anyone has a question. And if not, I will kind of take the lead again.
I have a quick question regarding like the number of schools that you ended up applying to. How did you kind of choose that? How did you navigate, if you're applying like to a lot of schools, dealing with the secondaries and stuff like that?
I guess I can start with this question. So for me, it's a combination of where I want to go and also kind of my family's financial situation. Because like secondary is very, very expensive. You pay, I forgot how much, like 100 for your primary application, and then you're like an additional 150 for your secondary. So I think like finance is definitely one of the most important factor when I determine how many schools I apply to. And then the second aspect is like where I really want to go. Like I'm a person that's kind of paranoid. I'm not really confident with like about myself. So I would definitely want to apply to a wider range of schools. Kind of like, having like, the mindset of having a safety school. But in fact, like I think medical school doesn't have the notion of safety school anymore. Um, but I do feel like, sometimes if you're not choosing a school that is the perfect fit for you, they'll probably not gonna even grant your interview. So like I think finding a mission fit is extremely crucial. Like if you're someone who's like very, very into research, but like, maybe not so much in, serving the community, and the service-oriented school might not be the best fit for you, right? And, same can say with otherwise. So I feel like, choosing the school that really fits your profile is how I was able to narrow down my school list.
Yeah, I'll just say, like, in terms of just strict numbers, I applied to 23 programs, and I feel like that was actually on like the low end of what I heard from people in like this cycle and past years. And I'm gonna be so honest, by the end of that, like the last two, oh my God, I like could barely get myself to do them. And of course, that's gonna be the case, like, regardless if you apply to like 40 programs or not, but be so honest with yourself about how much work you are not just willing to put in, but like how much time you're going to have to dedicate to it. Because that was probably the most mentally hard part of the whole process, aside from like just waiting, is saying like, okay, I have like a 2 week turnaround to like, once I've actually gotten these questions to like send them in and make sure that they're quality and they don't have typos and they are for the right school and like all of those things. And so it's better to apply to like a smaller number of programs and have really, really high quality responses and that you feel like everybody has said that you really mesh with their program than to apply to like 50 schools and say like, oh, here are all of my like so-so answers, and then be like heartbroken at the end that you didn't really hear from very many of them. Again, there's no guarantee for anything, but like do yourself a favor and like really sit down before this starts and think about it and say, how much time am I putting into those secondaries? Because it's going to be a lot less than you hope.
Thanks, Ashley. That was a great answer. Go ahead, Zeta.
Yeah, I just wanted to piggyback off that. I also ended up applying to 23 schools. I actually lost one to secondary that didn't get done. So it happens. Like there's going to be a time where you truly consider, because it is a lot of essays. Like I think if I ended up, the count I had was like over 90 something essays that I was writing, independent essays for these schools. And so, and some of them are really long and you're like, what's the point? So you really have to think like, I, at the time, I would say you pick schools that you are like, I would genuinely be 100% happy to be there. If there's any school that you question even it for a second of like, I don't think I would be happy there are more than enough options to either find a different one or just don't worry about it, because the amount of time you're going to put in is just, it's, and an exuberant amount. And then also in terms of category, not that there is safety schools, but if you had like to give it numbers, I think it was like 6 to 7 or like lower end, like 6 5 reach like dream schools, 7 to 8 like typically like reach schools within my like maybe a little bit outside my MCAT score, but kind of close. And then like target schools more like 8 or 9. That was probably the rough number that I was dealing around to kind of categorize which schools I was applying to where, and like still keeping that broad categorization with still a small number of schools. That makes sense.
Yeah, I think the overall goal is, to only have one application cycle and have that be it, so that you don't have to necessarily go through it a second time. So keep that in mind. That's not to say that you necessarily want to apply to 40 plus schools either, but make sure you have enough time to dedicate to each individual school to put your best self out there. And also like consider your schedule in that time. So like around the middle of the summer is when the bulk of it is going to hit. So think about, what commitments do you have, and can you kind of move things around or kind of take a bit of a step back, so you could focus on your application in that time.
Just a quick add on to since we're talking about secondaries, I think, everyone's been telling this like it's really time consuming. It's probably the worst time of my life, if I have to be honest with you. But I would recommend like start it early if you have the bandwidth to do so, and like start with the prompts that are more universal. Like for example, like why medical school? Like what's your biggest challenge, right? Like describe a time when you work in a team, and diversity statement, right? I think those four are very common across different medical schools. So like if you're able to write those like, general kind of like passage down for each of the prompt, it'll be easier for you to kind of like fine tune it and do some edits to make it tailored to different school. And then like in terms of like the school specific prompts, then I would just recommend start early, utilize the resources like SDN or admin.org to look at the past like secondary prompt, and then trying to, come up with ideas and like brainstorm early.
One other thing about writing, don't get too attached to the things that you have written, whether it's your personal statement or your secondary essays. I can't tell you how many completely unique versions of my personal statement and even some like secondary essays I had, and like I completely scrapped some. Like some of it I got feedback on from other people and I was like, oh wow, this did not read the way I wanted it to. Others, I was just kind of like, it doesn't really fit what they were asking. I realized that after I had like almost finalized an essay for like a secondary. And it's like, as much as you want to stick to like generally that like timeline that's put out about, turnaround for secondaries, you also just want to make sure that you actually put in your best work. So don't be too nervous about like submitting your primary a few days after or like even a couple weeks after the submission like opens, and same for the secondaries. Like truly do not stress about those as much as the quality of your content of your application.
Thank you so much. I think that was really helpful, and I'll think about that. I really appreciate like the honesty and the realism. That's going to be very helpful.
And I think Missouri had a question in the chat too. We probably have time again for maybe one or two more. I think we're going to go over a little bit if that's okay with the panelists. But the question was, did you have any interesting interviewing experiences that you feel helped build a rapport with a school?
I don't mind starting. With interviews, it's everything was over Zoom. So you kind of, at least for me, everything is over Zoom. I think most schools are now doing Zoom, which is great for money reasons. So fantastic, not having to travel. But I would say, in terms of a special experience to build rapport with the school, I guess I would say like you really learn about just like the structure of how they set up their Zoom environment. So if they have you jumping through rooms, especially for like the multiple mini interview, jumping through rooms to like different and like the structure where they put you in a waiting space. Do they have you talking with other interviewed students? Are you talking with faculty or staff? Like really like are they open to questions? Are they giving you always opportunity to ask questions? I feel like is things that you can kind of tell based on how much the school really wants cares about making sure because it's during the application process, it's a two-way street. It's like they're saying if you fit, but you also are trying to learn more about the school to see if like, does the school really fit? Do they match what I read on their, like what I read on their website? And so if their school opens, some interviewers just didn't ask me after the interview, even if we had extra time, do you have any questions? They just didn't ask it. And so it's kind of like, why is that the case? Maybe they don't, they're not as interested in providing that information. Some of them didn't have opportunities maybe at the beginning of the interview day to open up and ask questions. So I feel like there's definitely one specific moment I do remember though is I had a group interview experience. Super weird. I don't it was felt very awkward because it's you and three other students who are also trying to interview for the same spot. But I felt like just that was the way you build understanding about the school. You could just see the way they structure their interviews is like the fact that you have this like 3-on-3 battle between you three at like three people on the admissions committee and then like you three students comparing answers with each other. I felt like for me that didn't fit for me for that school. And so that was my way of learning about fit. It's just kind of like vibe of interview and the way they structure and how they treat you in the interview process. And so sometimes it can be helpful to tell you like, nope, that's not for me. Or like, that was amazing. I didn't even realize it. I didn't realize how much I would like that school.
And I'd like just to add on a little bit. Like I think there's a yes to this question and a no to this question. I think the yes part is like you can always be better at interviewing. I think you can be professional, get to know your personal statement well, and like do a lot extensive research on your school, right? Like what curriculum do I offer? Do they have special opportunity? Is there a faculty mentor that you want to work with? What is the school patient population is looking like? The location of the school, and like for example, like if they have like fifth years or like 6 year of research year that they offer, I think these are all like things that you can do to prepare for it. But like the no question part of this answer is that like it's really random, right? Like the people who are interviewing you are random and you don't know their personal preference. Like for example, I had an interview who like this interviewer really liked my research and he actually knows my PI very well. So he really like we have a very good conversation and I'll like eventually I got into that school. But there's also time where like, there's one like it's actually one of my top choices. For that interview, the interviewer is really like unconvinced about like, AI or medicine, like integration of those two. And so he has been skeptical about the work and like, you can feel like there's a tension between me and him. So I feel like at the end I didn't get in. So I feel like, this process is so random. You can't really control. So I'll just say be yourself. It's like, I would say it's like, dating, right? Like, there's like, peaches and there's oranges, right? Like you can choose peaches over oranges, not because peach is just more nutritious. It's just like, it's a personal preference. So I would say just be yourself and like be confident. And if they don't choose you, it's their loss, right? So yeah, I wish everyone good luck with interview.
Yeah, I would say in my experience, it wasn't entirely random. I definitely got paired with people who either had like faculty who either had the same specialty as what I do research in, or even if that wasn't the case, it was like something that I talked about like shadowing in, or they were really interested in health equity and like I did volunteering that related to that. And so you pretty much get your interviewers' names like at least a day before, in my experience. And so I definitely did my homework on all of them. Like you may feel a little weird about it, but there are ways to kind of like slip things into your interview that are like, I am passionate about health equity stuff. And so like I'm gonna mention that and make sure that comes up in my interview with somebody who I know is also interested in that. And it's like making sure that you're on top of the conversation because to some extent, unless they're literally just asking you question after question, which does happen sometimes, you have the opportunity to steer things a little bit. And if you drop something in, chances are they're not just going to stick to the script and be and like actually expand upon what you were saying. Um, I had not a group interview, but like a group activity. And it was like recorded so that they could watch it later. There was nobody in the room, like in the Zoom room, but and it was like completely not medicine or science related, and it was great. Like it was literally just to see how you interact with people. Like, are you respectful? Also, it was a bit of critical thinking, but like there were no right or wrong answers. And so it's just one of those things where you go, okay, I'm just gonna work with a group like I do anywhere else. And, obviously you want to be on your best behavior, but just, don't sweat it. Like they've given you the interview offer. So at that point, it's past all of the like, stats. They think that you would be a good fit. And so as much as you want to impress them and, you don't want to like fumble an interview, right? Like being unprepared, you also like both of them already said you're kind of interviewing them to be like, is this right for me? So yeah, those are the big things.
Yeah, I'd say definitely do your homework beforehand, not only on the school, but maybe because the interview process can go like for a while, like all the way from August till pretty much until like April or so. And so, do your homework in the school, what you wrote to them, so what your application had, and also like about yourself, like, just jog your memory about some of the experiences that you might have had or any like anecdotes that might have really stood out to you or kind of like made you who you are now. So definitely come prepared. And I'd say also come prepared with like questions too. Um, that way it also shows that you're interested in the school. You do want to learn more, not just from the conversation that you're having, but also like, is there anything else that really seemed unclear or that would kind of influence your decision on whether you'd go there or not, or what would really make it stand out that much more to you. So always come prepared. But yeah, I think we definitely touched on pretty much everything else there. I think overall, in my experiences, I kind of preferred like the individual interviews more than MMIs. I'm not sure if everybody else feels the same way, but I think it is nice to kind of be able to sit there and have like a conversation, even though over Zoom, it's kind of face to face for a period of time and kind of get to know somebody instead of the MMIs. They're just you kind of getting pushed from room to room and kind of rapid fire questions. I'm not sure. Some people might really enjoy the MMIs compared to a more typical interview or a traditional interview, but that was just my preference and experience.
Thanks so much for sharing all that. And before we wrap up, I just wanted to again thank you for being here and for sharing your experiences with your classmates and some alum. And again, thanks to all of the participants for being here. And my last question for you is any advice or last words that you have for anyone on this journey right now?
I would say as much as this process is very serious and you want the best possible outcome, don't sweat it. Like really, once it's in, it's in. It's like it's out of your hands. I mean, you can send like, a letter of interest or intent or an update. Like actually do send an update letter if you haven't heard from a school you really like. But at the end of the day, it's not really a reflection of you if you don't get in. Like all of us are trying to be unique in some way in the application, but the reality is just that there are so many thousands of people applying that there are going to be a lot of people who are very much like you or who have some specific thing that those med schools are looking for that maybe you don't have and that you never will. And so, just don't take it too personally if you don't get in somewhere. And if you do get in somewhere, even if it's not your top choice, like please do your best to really celebrate that because you don't know if another one will come. And even if another one does come, it's really important to like kind of bask in that success for a little bit because this process is not all for naught. So make sure that as much as you kind of like, oh, I know a lot of us put pressure on ourselves to like do everything as well as we can, but take the time to also like make sure that you acknowledge that success that comes with it, no matter what that looks like for you.
I guess I would just echo that, like, acknowledge the success. It's a long process. I don't think like you hear it's a year, you know that like you hear the dates and you're like, oh, cool, yeah, it spans. I start in what May and then it ends in April the next year. Like you hear about it, but it truly when you're in it, it is extremely long. And so the timing in which good news will come and bad news will be completely random. Like your life is going to happen throughout this year, especially if you're in a gap year, even if you're in school. Like you'll be in the most weird, not weird, but you'll be in maybe in class and you'll get an email telling you about whether you got an interview or whether you got something. Like, don't try to just live your life in between. There's obviously going to be more high stress moments, like when the secondaries come around and when you're submitting your primary for the first time. But after that secondary is committed, just like Ashley said, like, it's kind of, you've done what you needed to do. Like, don't worry about it. Maybe do schedule the mock interview with pre-professional advising so you have that date ready and set, and like kind of remind yourself of who you are, and like know how to answer those general questions of tell me about yourself. Like, get used to just talking to people. So kind of make, at least for me with prepping for interviews, like to make the process seem less like I'm stressed and preparing for something. After secondaries, I kind of treated it as like, okay, I'm just gonna live my life. And occasionally, for the people who know that I'm applying, I'm gonna ask them to just ask me like, why medicine randomly throughout the day? You know, like trying to just interweave it with my day-to-day life, because at this point, you're gonna spend another like 8 months, 6 months, kind of just waiting around for someone to be like, hey, I want to interview you next week, or hey, look, you got into this school. So like celebrate those small successes, but also try to like, again, just live your life. Like, let yourself forget about it. It's okay once things are submitted. Do what you want to do, and then you'll be reminded, and then let yourself forget again. And that's a good way to kind of let the cycle, I think, pass, like the timeline pass as stress free as possible.
Yeah, so one thing that I'd say about it is, definitely stressful. It's a long process. Trust the process. But yeah, I think as hard as it is, try not to compare yourself to others. Everybody's kind of on their own sort of boat going through this process. And so, somebody might be really successful, whereas other people it might kind of come in a little bit later in the cycle. So um, just you're on your own path. Celebrate your successes, and when those interviews come in, for all you know, it might be your first interview or your last interview. So, give it your best shot, put your all into it. And what I would say most is, especially that since we're a very big pre-med school and a lot of your friends are probably also pre-med, try to be respectful of others as well. I think everyone's preferences are a little bit different in this process. Some people are more than happy to share about how things are going, whether it's going really great or they might be having a tough time. But other people might be a little bit more private about it and might prefer to keep to themselves, or yeah, so definitely, be respectful of others, or try to be. Um, and yeah, just make sure you ask about those preferences first. Because you wouldn't want to necessarily make someone else feel like things are going rougher for them necessarily. I mean, it's rough for all of us. We all kind of have like a little bit of imposter syndrome going on too. So if you've made it here, you've done a great job already. So celebrate that at least.
Yeah, I would definitely agree with Juan just said. I think for me, like sometimes I also compare myself with others. But I think like, when you're comparing, where like you're comparing what you don't have with someone else's strength, like you kind of divert your attention on focusing on what you can do better, right? And I think like, there is no failure in this process. I think, you have done you have made so much impact in our community through your volunteering, through your research, through your clinical hours. You're already a winner. So I think you should always just be confident in yourself. You will definitely get into somewhere that you want to go, and you will like excel in being a very great physician in the future. So I wish you best of luck. And I'm gonna drop my email in the chat. If you have any question, please feel free to email me.
Thanks so much again. Thanks to the panelists and thanks to everyone who was present this evening. The video will be posted on YouTube, and I am dropping our YouTube link again in the chat. Yeah, if any of the alum that wanted to share, you can feel free to drop your info in the chat as well. But if not, I hope everyone has an amazing evening, a great rest of your week. Good luck to you if you're taking finals next week. And yeah, happy summer to everyone. Bye.
Bye. Thank you so much, y'all. Bye.